Hello friends, let's revise surgery quickly. Vapaltroid it is for insulinoma. There is symptoms of hypoglycemia post fasting or exercise, and plasma glucose is less than 50 mg per deciliter, and patient gets relief on IV glucose administration. Next one, a wound healing. Macrophage appears and it is peak at day 3. So at day 3 macrophage is too much. Next one, we have this adrenal mass. So most common incidentaloma for adrenal mass is non-functioning adenoma, but most common functional tumor is Cushing adenoma. Next one, alpha fetoprotein. If it is more than 40 nanogram per deci per ml, it is almost diagnostic for hepatocellular carcinoma. Fothergill sign. What is Fothergill sign? This is abdominal wall mass, just like hematoma, and this do not cross midline even on tensing. Rectus abdominis, it is not crossing midline and it is palpable. So this is the Fothergill sign. Abdominal wall, like hematoma, is not crossing midline. Next, baroids. What is this? Breast imaging reporting and data system. So 0 is incomplete assessment, 1 is negative, 2 is benign, 3 is probably benign, and there is a risk of less than 2% malignancy. 4 is suspiciously benign, and there is risk for 2 to 95% malignancy. 5 is highly suggestive of malignancy and more than 95% chance. 6 is biopsy proved malignancy. Next one, achalasia cardia. Achalasia cardia also has triad, dysphagia, regurgitation, and weight loss. Next one, Forest classification is for peptic ulcer bleed. Forest classification for peptic ulcer bleed. So it is 1A, 1B, 2A, 2B, 3, 2A, 2B, 2C, and 3. 1A is sprouting bleeding, means it is forceful like jet, and 1B is oozing bleeding, 1B. What is 2A? A is visible vessel, 2B is adherent dot, 2C is a black spot. This is only black spot, hematin closed. Okay, so 2C is black spot, this is 2C, and clean base is 3. Next one, superior parathyroid gland. Parathyroid gland, it developed from fourth pharyngeal pouch. Inferior parathyroid gland, it originates from third pharyngeal pouch. And parafollicular C cell, it originates from neural crest cells, and it is responsible for medullary carcinoma of thyroid. Parafollicular C cell. Next one, what is this instrument? Ligature, and it can seal up to 7 mm diameter of blood vessels in 2 to 4 second application, and it uses body collagen and elastin for this its action. Next one, what is incidence of Hirschsprung disease? It is 1:5,000. Next, what is this? This is OT table in the surgery, OT room. Okay, and the laminar airflow has to be in OT room. Okay, and it is a minimum required ventilation air change per hour is 15 to 25, normally between 100 to 300 air change per hour. and ideal temperature is of OT room is operation theater is 18 to 25 degrees Celsius. Next one, metabolic response to surgery and trauma. Metabolic response to surgery and trauma is decrease insulin, decrease testosterone, decrease T3, and decrease IGF-1. Next one, high mixed venous oxygen saturation. High mixed venous oxygen saturation is seen in septic shock. Next one, wound closure by primary intention, secondary intention versus tertiary intention. Primary intention is wound is closed, cleaned and closed with then finally with suture. So age approximation is there, is done. Okay. And next one, secondary intention. So here is loss of big amount of big chunk of tissue, so approximation is not possible, and there is possible infection here too. So wound is left open, of course with treatment, antibiotics, etc., and then it is left open to healed by itself with granulation, contraction and epithelialization. Okay. Tertiary intention is the also known as delayed primary intention. Primary means again, if there is word primary, so suturing has to be taken. So wound is initially left open and left somewhat be healed itself and then finally close. Next one, what is this Melanese synergistic gangrene? This is the abdominal wall infection. And this causing gangrene is known as Melanese synergistic gangrene. Okay. What is Fournier's gangrene? It is the scrotal infection. Scrotal infection is the Fournier gangrene. Next one, this is what tropical chronic pancreatitis. Here is the cassava fruits, and the persons consuming this product cassava fruits regularly can develop this tropical chronic pancreatitis, also known as chronic calcific non-alcoholic pancreatitis. Means it is non-alcohol, it is not doesn't depend on alcohol consumptions. So patient pancreas will have dilated loop, intraductal calcium carbonate stones, so multiple stones, and there will be increased incidence of pancreatic carcinoma, and also patient will develop diabetes mellitus 1 type 1. And the treatment of this condition is a side-to-side pancreaticojejunostomy, two rolls loop, also known as Petzlow procedure. Petzlow procedure. Next one, minimal access surgery. Minimal access surgery. The disadvantage of this one is loss of tactile feedback to the surgeon. Next one is radiolucent renal stone. So lucent means able to look through it. Lucent, look through it is possible. So we have UTI-X stone. So this is mnemonic UTI-X. So U is uric acid, T is triamterene, I is indinavir stone, and X is xanthine stone. Next, what is this? Air under diaphragm. But wait, this is Chilaiditi syndromes, and here we can see the air is inside bowel loop, and that this bowel loop is in between diaphragm and liver. So this is giving false impression of free air. Next condition, this is the brain tumor, and brain tumor will cause increased ICP. So patient can develop projectile vomiting, seizure and focal deficit. but speech disorder, speech problem is not the symptom of this brain tumor. Okay, so in children versus adult, so primary brain tumor in children is most commonly is pilocytic astrocytoma. In adult, primary malignant astrocytoma, primary brain tumor is malignant astrocytoma, also known as glioblastoma multiforme. Next one is during parotidectomy, surgeon accidentally cut buccal branch of facial nerve, and that need not to be repaired. So cutting of a buccal branch during parotidectomy, so of course accidentally, this doesn't require a repair. Next image, this is a thrombophlebitis of superficial vein of breast and anterior chest. This is known as Mandur disease. Next image, this is orange skin like appearance we see. This is of course one sign of carcinoma, invasion of dermal lymphatics in breast carcinoma, and this corresponds to stage 4B, and only stage 4A if this is mentioned. This is chest wall. Of course that do not include pectoralis major. Next one, bipedical flap. It should be bipedical flap. Okay, bipedical flap is a buccal handle flap, and this is used to repair eyelid. Next one, when we have to stop hormone replacement therapy before surgery, this is before 4 weeks. HRT should be stopped before 4 weeks of elective surgery. Clopidogrel at least 5 days before, and lithium 24 hours before. Next condition, this is cafe outlet spots, and this is not going to transform into melanoma, so this is not risk factor for developing melanoma. So what are the risk factor for developing melanomas? So this is xeroderma pigmentosa, giant congenital pigmented nevus, and there is history of sunburn. Next condition, unilateral cleft lip repair. When has to be done? Between 5-6 months of age. If bilateral cleft lip repair has to be done, then the first repair has to be done at 4 to 5 months of age. Next and last one, most common arrhythmias in laparoscopy. Most common associated arrhythmias in laparoscopy is sinus bradycardia. This is due to stretch of peritoneal membrane that is supplied by vagus nerve. So friend, thank you very much. Please like and subscribe my channel.